Hi, I'm Douglas Blackstock and I'm the Chief Executive of the Quality Assurance Agency for Higher Education, the QA, and I had the privilege of being a judge for the Alliance Awards this year. Unfortunately, I can't be with you live because I'm on a train at the moment on the way back from Glasgow. You might guess why I've been there, and hopefully I'm extremely happy after Scotland's miraculous recovery. For the category I was judging, the Alliance Award, we were really looking for examples of individuals and teams who have demonstrated great collaborative working. The last year has placed exceptional demands and pressures on Alliance teams, as it has on all of us. And the togetherness and collaborative spirit as a sector has never been more needed as we navigated the challenges of the pandemic. We received a large number of nominations for this category, which all brought to life this inclusive and supportive culture, which I know from having worked in two Alliance institutions is found across the whole of the group. We learned about new collaborations being formed across departments and teams within universities and even around the world to develop new strategies, ways of working and projects through the pandemic. We heard of individuals going above and beyond to offer support for colleagues in times of crisis, and we learned of new partnerships being formed in the community. A huge congratulations to all of those who were nominated. Now let's find out a bit about those who made it onto the finalist shortlist.
I'm absolutely delighted to announce that Professor Matthew Witt and Joanna Alberg have been shortlisted for the Alliance Award for the leadership of the University of Hertfordshire's A Changed World, a digital archive initiative which captured the personal and professional experiences during the COVID-19 lockdowns. The project was driven forward by Matthew's vision and Joanna's tenacity, engaging all parts of the university community to come together to showcase their experiences over this exceptional year. They made a powerful team that delivered something truly unique and inspiring. Well done, Matthew and Joanna. The university is very proud of you.
Teesside University took an innovative approach to putting values into practice through the creation of the Values and Behaviours Framework. Over 100 stakeholders were engaged in a series of workshops which ensured that different viewpoints were embraced with meaningful engagement in the co-creation activity. The Values and Behaviours Framework provides a reference guide to help all colleagues understand how the values of the university can be applied within their roles and working practices. The initiative transparently sets out the standards of behaviour expected of all staff, people managers and senior leaders working together as Team Teesside. The framework continues to be embedded throughout the employee journey. There is a specific link to the performance of every colleague through the professional development, planning and review process. Success has been measured through positive employee engagement data and qualitative feedback from stakeholders.
Hello, my name is Darren Pickles and I'm an Associate Head here at the School of Media and Performing Arts at Coventry University. So our collaborative online learning project involves students from several different institutions forming groups and making electronic music tracks. And I think what's remarkable about this project is that it's not just Coventry University students working with students from one other institution, but it was a much bigger project involving staff and students from 4 separate institutions in 3 different countries. This meant that there was a considerable amount of work involved in arranging students into suitable groups with similar musical interests, but also with complementary skills, while also ensuring that there was no more than one student from any one institution in each group. The diversity of musical interests and cultural backgrounds of the students produced a wide range of music, from cinematic music to rock and dance. and the students gained a unique experience of cross-cultural collaboration and produced work in ways that they never would have imagined, all while working in a situation that replicated real-world industry practice, with the students having to produce their own work in a really short turnaround time. And we're really proud to endorse their submission. Thank you.
I'm Richard Van-Arts. I'm a GP in Kingston upon Thames, and I've been working with Kingston University over the last 6 months to develop our vaccination service operating out of Kingston University. So I've been working with a number of other local practices in Kingston, and we very rapidly realised at the point at which we were starting to explore vaccinating that it was going to be very, very difficult to do at any kind of scale without a very large amount of support in terms of buildings and personnel. And so we approached Kingston University, and they were very keen to work with us. So my practice has been working with Kingston University for 20 odd years, and we provide the medical care for the students on site. So we've got a good pre-existing relationship with them, and we're able to build on that and create something really quite extraordinary at the university. And Kingston University have been incredibly enthusiastic about supporting this programme. They've provided us with the most enormous space. We have volunteers, we have staff there that are helping support us and get the patients through and things of that sort. So we've been able to operate on a scale that would just be impossible with practices working on their own. And to date, we've provided 33,000 vaccines at Kingston University. At one point, we provided over 2,000 vaccines in one single day. And at one point, it looked like we were the biggest vaccination centre in the country because of the volume of vaccines that we were providing in such a short space of time. And it's impossible to overstate their contribution to this, because the scale and speed by which we've been able to do this has made our patients so much safer, far quicker than it would have been possible to do so otherwise. And Kingston University have really understood the importance of reaching out to the community and vaccinating as many local residents as possible, as quickly as possible, in order to allow our local vulnerable people to find a way of starting to return to normal. And now, as we've gone through our cohorts down to everybody over the age of 18, it's a huge number of people in the local area that can thank the support that they've received from Kingston University and their local practices to be able to get to the point where so many people are vaccinated in our local community.
That's actually really great. I think you've answered pretty much both of the main points that I put down there. Was there anything else you particularly wanted to add?
I think that all I'd really want to add is that going on into the future, this really sets a great foundation for us working in a more effective and collaborative manner with the university than ever before. Because I think previously we've had good relations with them and we've been able to provide good care for their students. But actually, this has really demonstrated that the sky is the limit, and that we can really start to do some interesting, innovative things with the university. And as health and social care become integrated, we also want to become integrated with other local community partners. And Kingston University is such an enormous part of our city and our town here in Kingston that we would be daft not to take advantage of the possibilities that have been opened up. And they really seem keen to explore these possibilities going on into the future as well.